Conjunctivitis cases are on a rise all across North India. Hospitals in Delhi are said to report about 100 cases every day. To understand what conjunctivitis is and what needs to be done, I have with me today Dr. Umang Mathur, who's the ophthalmologist specializing in cornea, cataract, and LASIK surgery. He's the executive director at the Dr. Shroff's Charity Eye Hospital. In fact, he's the one who founded the Eye Bank at the SCEH. Welcome to BW Healthcare World, Dr. Umang Mathur. First of all, thank you so much for taking our time.
My pleasure.
What we are facing today in North India with conjunctivitis, it makes it very important for us to take up this topic. And so before we get it deeper into it, can you explain to us what exactly is conjunctivitis?
So conjunctivitis is basically an infection of the outer layer of the eye. So if you see the white portion of the eye, above, in front of that, there is a transparent with a vascular kind of membrane called conjunctiva. So infection of the outer layer of this layer is called conjunctivitis. And because eye is a very exposed part of the body, so it is prone to infections. And conjunctivitis is generally a very common kind of a problem that can happen.
Right. And Dr. Mathur, what are some of the causes of conjunctivitis? And specifically, why are we seeing suddenly so much of conjunctivitis being spread in certain parts of the country and not everywhere?
So conjunctivitis is commonly because of a viral infection. Although you can have some conjunctivitis because of bacteria. But what you see generally as an epidemic, and after COVID now everybody recognizes viruses, but so this is one virus which is generally the adenovirus, which is very contagious and causes epidemics commonly. So that is the most common cause of conjunctivitis, especially when you see it widespread. Bacterial conjunctivitis also occurs, but it is not that common to spread the way a viral conjunctivitis spreads.
Right. And Dr. Mathur, what are the common symptoms by which we can recognize that it could be a symptom of conjunctivitis? And, typically whenever there's a dust also that goes into our eyes turn red. So how do we know that, this could be conjunctivitis or this symptom is something that we should not be worried about?
Sure. So red eye or pink eye is what is the commonest that you see. Your eyes do become inflamed and red. That's because the blood vessels dilate whenever you have inflammation. So the commonest would be that you have a red eye. But you're right in saying that there could be other causes of red eye also, like a foreign body could cause a red eye. There are some certain inflammations inside the eye that also cause a red eye. There could be sometimes a hemorrhage at the surface, which would also make it red. So conjunctivitis usually is redness, would not have a lot of pain. There could be some discomfort, but usually in the beginning, it is mainly red, along with watering, and more importantly, there could be mucus kind of discharge. Especially when you wake up in the morning, you'll find your eyes are matted, sticky, there's discharge on the lashes. That is the commonest cause, the commonest symptoms that you see of conjunctivitis. You may have a little sensitivity to light. And it also depends a lot on the severity and the strain of virus. Some strains cause more symptoms and the others are not that bad.
And Dr. Mathur, what do you think needs to be done in such cases? What is the usual treatment protocol for in cases of conjunctivitis?
So one has to recognize that it is contagious. And it is a myth that if you look at a person with conjunctivitis, you'll get it. You generally get it with touch. So if somebody has conjunctivitis in the family, for example, touches his eye which has discharge, then opens a tap and washes his hands, but the tap may now have a virus. And somebody else in the family would use the same tap, would again, have a chance to get it, or sharing towels and, pillows. Those are the things that cause it to spread. It's generally what you touch, the door handles. You're traveling by public transportation, a lot of people bunched up together. So when there's an epidemic, you have to be a little more careful what you're touching, and you have to constantly clean your hands. People have got used to using alcohol swipes with COVID, almost the same level of precautions one should take nowadays. But once you have it, one, you should keep washing your eyes with running water and keep your hands clean with soap and water. It helps because you don't want the discharge sticking around in the eye.
Right.
Generally, it is difficult to clinically differentiate whether it's virus or bacteria. And so mostly we would prescribe a broad spectrum antibiotic to be put 4-5 times a day for a week. And for most people, that should be adequate. You could use a lubricant if you are having discomfort. These over-the-counter lubricants would also help. Most of the patients should be okay within 3 to 5 days.
Got it. And what are the chances of the recurrence of conjunctivitis? So if you had conjunctivitis, you got cured of it, what are the chances that it may reoccur?
So like with most viruses, you get a small window where you would have an immunity. So it would be rare that you got it today, and before this epidemic gets over, you get it again. Because you do get immunity to that strain of virus which is in the air. So it is not very common that you would get it again and again. Now, there are certain conjunctivitis, especially the bacterial conjunctivitis, where there may be a reason why you're getting recurrences. And the reasons could be that you have something, there's a drain that takes water from the eye into the nose. So sometimes it may be blocked, and that may be throwing up infections. Or there's a foreign body lying inside the eye, which is throwing up infections. Or if you have eyelashes that are inturned, you may get infections. Or you have a big tendency to keep touching your eye. And then again, you get infections because your hands may not be clean. So those are usually bacterial conjunctivitis. What you see today is this epidemic around, more commonly that this would be a viral conjunctivitis. And to your question, I think in a short period of time when there's a lot of people getting it, if you got it once, would not be very common to get it again.
Right. So Dr. Umang Mathur, you had explained that, if you have conjunctivitis, what is it that you need to do so that you don't spread it? For example, not touching anything else or trying to clean that space. Now, coming on to recommendations for people of how to prevent themselves from getting conjunctivitis, what are the things that people need to take care of?
I think it's almost what you learned during COVID, that if you are in a very crowded space, you have higher chance. So when there's an epidemic, maybe avoid if you can. Whenever you're touching things in public spaces, have an alcohol-based kind of sterilization solution by which you can keep your hands clean. And more importantly, avoid the tendency to touch your eyes all the time. People who wear spectacles that way are a little better off because the spectacles come in between and you're not touching your eyes that much. But essentially, you avoid touching your eyes and your face without cleaning your hands. You can keep washing your eyes with running water, clean running water, and keep your hands clean, and don't share tissues, handkerchiefs, towels, pillows, that kind of thing. So you basically can spread it by, what we initially did with the COVID, we overdid it with cleaning every surface and all that. Those are the kind of precautions sometimes are required for this.
Right. And Dr. Umang Mathur, my last question to you is there anything else you think people should be aware of related to conjunctivitis or its related side effects? Are there anything else that can happen?
Yeah. So there are other causes also that can cause a red eye, especially if you're just having symptoms in one eye and not both eyes. If you have a lot of pain and discomfort, you must consult a doctor. There's also a little tendency for people to use steroids, which will give you initial relief, but it should be used under supervision. And let only a doctor prescribe, if at all you have to use steroids. Don't use it yourself. Don't take it just because the chemist has given it to you. Because steroids have their own side effects. And once you are on steroids, which sometimes are needed to be prescribed, you must go and see your doctor at regular intervals, because sometimes your pressures may increase and you also become prone to more infections. There will be some cases where the conjunctivitis becomes a little more severe, that you are still symptomatic after 5 to 7 days. Your eyes are very swollen. You have discomfort. Do not miss the opportunity to see the doctor, because sometimes some patients may have more severe symptoms that need a little longer treatment. So, when in doubt, consult a doctor.
That's a right advice, sir, that when in doubt, consult your doctor. Let them decide whether it's conjunctivitis or anything else, and let them guide you how you need to get over with it. Thank you so much for taking out time to be with us, Dr. Umang Mathur, and sharing all your knowledge that could be useful to everyone who's watching the show.
Most welcome. Thank you.